I'm Tim Johnston with Module 3 of our team training for amazing customer service in a dental office. I'm building on Module 2, so if you haven't watched Module 2, please stop this, go back and watch, well, Modules 1 and 2, but this is really sort of part 2 of the first appointment. So let's keep on going. This is where we're going to get from hygiene to dental now. So your first appointment is wrapping up, you're about done, you've done everything we talked about in the last visit, gotten all the patient data collected, getting the doctor in and all that. So here's where we go from getting from hygiene to dental and how to make it work seamlessly and efficiently and provide best customer service for your patients. All right, number 1, please take photos before the doctors come in. My staff, my team members, my hygienists know that if there's no pictures on the screen when I walk in, I will about face and leave the room. I'll come back when they've gotten some photos of the teeth every single time. I don't care if everything's healthy. Take a picture of a healthy tooth. I want some data up there to let the patients know, number 1, we have some pretty cool technology. So cool technology means we're better dentists in their mind. And it does provide us a reference point going back and looking at things. Something finally starts to give way or break or whatever. We'll go back a couple of years, look at the old pictures of it and go, oh, well, looky there. There was fine there, and now this is chipped. So yeah, that's happened since your last visit. We didn't just miss it, which is a common question. How long has that been there, doc? So put it up on the screen, and again, I said the last time, expect the patient to ask, is that my tooth? Avoid all temptation to be snarky and sarcastic at this point. So I have a lot of stupid comebacks for that, but all we say is, yes, that's your tooth. There's a little, I don't know if you can see that on the screen, there's a little tiny fracture going on right here. Teeny, tiny. I'm not sure that I would have seen it with my naked eye. With my loupes on, I would, but in a blown up picture, I certainly will. You know who else sees it? The patient. They go, is that my tooth? And you say, yes. And they go, is there something wrong in the middle of it? Is that cracked? Yes, it is. I'm glad you asked. It's going to need to be repaired. So patients help to co-diagnose themselves. Patient education coming on board. When there's clearly a tooth that needs to be worked on, but the patient just isn't hearing you, right? You've got a big amalgam in there. It's an MODB, say, and you've got some tacky margins. You can stick down 1 millimeter or 2 into the crevice through the filling of the tooth. That needs a crown. I don't mean it wants a crown or you want to do a crown on it. I'm using the word need. That tooth needs a crown to maintain a long, happy, comfortable life in the mouth. Agreed? But your patient just isn't hearing you on it. Like, it's been fine. It's been that big silver filling forever. Here's something you can do. Take a tooth sleuth, or even just a Q-tip if you have it, stick it right in there, have them bite down on it, and ask them one question with a concerned voice, like this. Does that hurt yet when you bite down on it? What's my key word? Yet. Does it hurt yet? What am I implying? It's gonna. If it doesn't yet, it's gonna. Of course, the answer is always no, because if it was gonna hurt to your Q-tip or tooth sleuth, it would have hurt the last time they were eating something crunchy like Doritos or a nut or something. They would have gotten it, and they would have told you about it. So you put it in there. Does that hurt yet? This is a great convincer to help them do something that they need to get done. I am not unethical. I do not mean to say that you should be doing this on every tooth that you think needs a crown. But when you get to one of those ones where this tooth needs work and your patient just isn't getting it, here's a great convincer. The word yet comes across very nice, especially when you accentuate it. Is that hurting yet when you bite down on it? No. Should it? I'm surprised it doesn't. And then you can start down that conversation as to why. Then, after the initial hygiene services, get the doctor involved. Yes, you may have to pull him or her out of the room. Try not to have to. We wear these communicators in our ears, so usually they tell me, not usually, every single time, they tell me when they have finished the exam portion and they're getting ready to do the prophylaxis, the cleaning part of it, they'll tell me, and I'll hear this in my ear, Dr. Johnston, we've completed our exam in Hygiene Room 2 and ready for you when you're available. That's it. I heard it. I acknowledge. Thank you. Click the button and she'll hear it in her ear. I now have 20, 25 minutes to get over there where she's going to be cleaning teeth. So I can stop at a time that is convenient for me, go over there and do it. If she gets to the end of her services and I've either forgotten or just been too busy to go over, she will have a different message for me the next time. She'll say, Dr. Johnston, we are complete and ready for an exam in Hygiene 2. Complete, that's the key word. She is complete, done. Nothing else for her to do but sit there and make small talk, which means I'm going to start putting her behind because she's got another patient coming, which is my clue to drop what I'm doing. Unless I'm suturing, I will stop what I'm doing to go over there and do her check. It's an automatic mic drop. Drop your instruments, walk over there and do it. With one exception, if I'm suturing, because I hate to stop suturing and there's bleeding happening and all that. So go over there and get it done. But give yourself that time frame in the middle. When I come into the room, the doctor walking into the room hears the patient's name automatically in conversation. So let's say that Tammy has Robin in the chair. And as I walk in the room, as my footsteps come into her audible range, she will say, the first word out of her mouth is the patient's name. Robin, I see Dr. Johnston's coming in to do his exam. And then she can say whatever else she wants after that. We'll finish when he's done, or I'll be sure to tell him about that tooth you told me about, or be sure to tell him about your trip to Florence. He was there once too. Whatever, I don't care what it is, right? But the first word out of her mouth has to be the patient's name. So when I walk in, I'm not looking for the paperwork to find out what the patient's appropriate name is, because it might be Michael, or Mike, or Mick, or Mickey, right? It might be James, or Jim, or Jay. I don't know. I'd like to remember all my patients, and I remember some, but you know as well as I do, we don't remember everybody's preferred name that they like to be called. So instead of walking in and being formally a Mr. Jones, or calling him Mike when he goes by his middle name of Steve, these things happen. So as I walk in, as the doctor was in, the hygienist's first word out of their mouth is the patient's name, the name they like to be called by. That's huge. Then give the doctor a chance to make some small talk, right? 60 seconds is about all I want. Because after that, we start talking about how the cats are, and it's too much. I'll say, hey, Mary, how you doing? How's life been treating you? Oh, good. We just got back from a trip to Italy. Was it a trip of a lifetime? It really was. We went to this and that. If she starts getting too involved in the conversation, the hygienist will reach to the back of the chair where the automatic button is and push that button and say, let me go ahead and lean the chair back while you guys talk. At that point, she has interrupted us appropriately. She says, while you talk. She doesn't say, stop talking. But that's the message, and the patient gets it. She goes, oh, yeah, right, okay, go ahead, take a look. And that, because really, I do want to communicate with my patients, but I don't want to be over there for 10 minutes hearing about their grandkids or their cats or whatever or their vacation. Although sometimes I do want to hear about their vacation more, but I'll do it on my own time. When we walk up front, I'll take a moment if I have it to ask them questions about someplace I want to go. Anyway, so now the hygienist is going to go ahead, if it's more than 60 seconds, lean the chair back, get the process rolling. This is perhaps the most critical thing I can tell you, hygienist, to keep your doctor moving in your chair. Because they sit there and they get talking, and they just like to have a conversation. They don't want to look in your patient's mouth. I mean, I'd rather have a conversation. So after 60 seconds, it's enough time to build some rapport. That's all you're trying to do, really. Hit that button, doop, and say something. Let me get the chair leaning back while you guys finish talking. There's a lot of implication there that you need to move on. Now advise the doctor if x-rays were taken today. Dr. Johnston, we took 4 bite wings and 2 PAs today. Oh, thank you, and I'll turn my attention to look at it. As I'm looking at those x-rays, I will often say to the patient, Mary, has anything been bothering you in the mouth today? Or I'll say, while I'm looking at the x-rays, tell me if anything's been bothering you in the mouth lately. And then they'll usually say, no, it's been fine, or yeah, there's a little sensitivity here, and whereabouts there. The hygienist may fill in the details. So hygienist, just tell me if x-rays were taken so I can turn my attention to it. Then the doctor asked the hygienist if there was anything interesting going on. So now I'm in the mouth, mirror and explore, going tooth to tooth. I would like for my hygienist, and they usually do, follow me around mentally as I'm going. They know I'm going to start at number 1, I'm going to work around and finish on 32. That's my habit. I do it every single time. So if she's got a concern on tooth number 19, she'll wait until I get done. I'll say, whatever, Tammy, anything interesting findings today? And she'll say, yeah, when you get to 19. So that means she didn't see anything between 1 and 19. Great, I know that in her, she spent 2 or 3 minutes in every tooth, and in her eye, she saw nothing. So I'm giving it an exam, but I'm really not trying to look at every single flicking little detail in every single tooth. I'm going to get over there in 30 seconds or so and pause on 19. When I get there, she's going to say, I noted that from the buccal up in the furcation is starting to get some, whatever, some decay, or we're getting a deep pocket there, deep probing depth, whatever. So she'll follow me around the mouth. As I'm going physically, she'll go mentally and follow me around. If there's something general, like the patient's having a lot more sensitivity, we talked about how much Gatorade they're drinking, whatever, she'll tell me that right in the beginning as well. So now I want a tour of the mouth, is what I call that. I want a guided tour of the mouth from my hygienist verbally as I'm going through. That also provides the patient with some talk over. Most of those notes, almost always, are written down on the bracket table where I picked up my mirror and explorer from, by the way, so that I also see that until I get to number 19, there's nothing going on. I might even not ask the question of the hygienist until I get to the bottom arch. I might just keep conversation going with the patient about their cats until I get to the number 16, then I'll go, hey, Tammy, is anything going on that you noticed? And now I'm on 19. She goes, yes, right there where you are. I knew that. I saw her notes on the tray. So notes on the tray, that would be enough for us, but honestly, the patient needs to hear it. That whole talking over technique needs to happen. The patient heard it once when it went from the hygienist to the assistant who was charting, hearing it now for a second time as it goes, well, a third time, because the hygienist would have sat the patient up and told them what she saw. Third time is when she tells me what she saw. So the patient hears the talk over an awful lot. Doctor asks the patient if there's anything noticeable. Again, if you haven't done it by now, you better. And the doctor confirms the finding. And I look everywhere else too. So yep, sure enough, number 19, broken cusp, you're gonna need a crown. While looking, I'll also ask about the health of the gums. I tend not to say perio. How's the perio doing? Because that sounds like, how's the cancer doing, right? Well, if there is no perio, then how is the health of the gums? Oh, they look great. All the probing depths were 3 millimeters and less. Thank you. Oh, there was an area last time that was 5 millimeters, but we treated it with the laser, and now it's down to 3 millimeters. Oh, good, success. We love to celebrate successes. So we're good there. Then the doctor recommends any treatment needs and tells the hygienist the time needed, the degree of urgency. So I'll say, yep, we're gonna need a crown on number 19, a core and crown on number 19. I'll need an hour. And Mary, honestly, I would go ahead and get that done pretty soon because that's just a disaster waiting to happen if the other cusp breaks off. Or I might say, this clearly isn't an emergency, this isn't hurting you. If it needs to wait a few weeks or even until summer, whatever season you're coming up on, that'd be okay. So describe the urgency to the hygienist so that the patient hears it and knows that if this is something you're serious about, I need to get done now. You've got decay that's almost to the pulp. We better fix that as soon as possible. I want you on my next available appointment. Otherwise, they might go, well, he told me I needed a cavity. Didn't say anything more. I needed a filling. All right, the handoff up front looks like this. Alexis is taking Robin to Carolyn's desk, although I think I called her Deb in this. The paperwork would do the trick. If you filled out all your paperwork correctly, you could walk the patient up in total silence, hand that paperwork to Carolyn, and say, here. And she would then look down at the paperwork and spend a moment reading what needs to be done, the degree of urgency, how long the doctor wants. But to do that, she would have to take her eyes off the patient and totally ignore the patient for a moment while she did that. Now the problem is the patient wants to start talking about it. We don't want to give them control of this conversation. We want the person at the front desk to control that. So Alexis will tell the front desk person, Dr. Johnston noted that tooth number 19 is going to need a core and a crown. He'd like an hour for that as soon as possible because the decay is getting kind of close to the nerve. That was all in the paper, but now everybody's heard it. Fourth time the patient has heard it. It's in their brains now. They better figure out this is what they want. So again, she would have to take her eye off the patient to do that, and that's not who we are. That's not who you want to be for your customer service. You, like us, are trying to run a high-tech, high-touch practice so that we are always in constant communication with our patients, letting them know what's going on. They hand off a little more. Speak to the next person in plain English. Don't say he needs to do an MOD on number 30 and he wants so many units of time, 6 units of time. She needs a filling on number 13, and Dr. Johnston said he'd like an hour. I wouldn't take an hour for that, but you get the idea. Plain English, the patient understands it. Make sure that what you're saying is consistent with what's on the treatment plan. So don't write down 19 and then tell the front desk about tooth number 14. Just make sure you're consistent. It seems obvious, but you'd be surprised. Be bold, be vocal, be confident. You're not going to go up there and mealy mouse it. You're going to tell the person up front what needs to happen. This is not a wishy-washy statement. This is what needs to happen. Use action words, not timid words, right? Action words is this. Deb will get you scheduled for that crown on the upper right side, specific location, that Dr. Johnston told you you need, right? All those are confident building words, as opposed to the timid version. Deb can schedule you for that crown that Dr. Johnston wants to do. There was no call to action. It was more like Dr. Johnston wants to do this crown. No, you need to have this crown done. Deb can schedule you? No, Deb will schedule you. It's a series of confidence words, a series of let's get to work, action words. They're going to complete this. What if the patient does not need any restorative care? Great. The handoff confirms the next appointment, which is a hygiene appointment. Our patients always leave our office with their next appointment on the books, even if it's 6 months away. Why? Because it's important. Good oral care means, for the most part, every 6 months, with some variations, some longer, some shorter, but we always confirm the next appointment. And we tell the front desk that. We say, Deb, Robin's here. She's in great shape. We're going to see her again in 6 months. And then Robin can make sure the appointment has been scheduled in the back appropriately, make sure there's no cost for today or collect the fee for today if there was one, and move on. But it's a handoff nonetheless. That is the end of section 3. I hope you've enjoyed that. That's sort of the second half of module 2. We're going to move into further patient education and consumer type issues coming up next.